Hello, I'm Ivy, and this is my presentation on autism spectrum disorder in girls and women. So, we're going to be going over the basic facts of autism spectrum disorder and specifically autism spectrum disorder in girls and women. We're going to look at diagnosis. The section does say diagnosis and treatment, but I just want to note that there is no real treatment or cure, rather, supports that they can get after being diagnosed, which is what we'll talk about in psychosocial impact and educational impact. Psychosocial impact will also talk about how their life is affected, specifically with regards to relationships and then finding a career. And then educational impact, how do we adapt our classrooms to support these students and to make sure that they succeed? So, starting off, we're going to go through some basic information. I'm going to move sort of fast through this because this is already in the textbook and we've already done our chapter on autism spectrum disorder. But IDEA defines autism means a developmental disability affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects a child's educational performance. The IDEA definition also talks about other characteristics that are often associated with it. This is important because IDEA notes that autism does not apply if the adverse effect to educational performance is primarily from a separate emotional disturbance. And it also talks about how, despite in the definition saying generally evident before age 3, if a child manifests these characteristics after age 3, they can still be identified as long as they have these characteristics that the definition lists. Now, because girls and women are often undiagnosed or misdiagnosed early in life, we want to focus on diagnosing after age 3 for a lot of this research because usually that is the case with girls and women. So, for prevalence rates, autism spectrum disorder is the fastest growing IDEA disability category. Currently, 1 in 36 children are identified with autism spectrum disorder. But again, what we want to focus on is that for every one girl, according to the CDC, 3.8 boys are identified with autism spectrum disorder. Now, autism spectrum disorder has some broader characteristics: impaired social and linguistic functioning. Children with autism spectrum disorder often struggle with understanding the perspectives and emotions of their peers. They can come across as extremely aloof, and it's not uncommon for young children with autism spectrum disorder to be nonverbal or speak in largely non-contextual phrases. Children with autism spectrum disorder often have very repetitive behaviors known as stereotypy, and also have very strict routines that are very inflexible and can even result in what's the textbook refers to as a meltdown when these routines are changed. Children with autism spectrum disorder can be either over-responsive, under-responsive, or even a mix of both, where certain stimuli can be very overwhelming for them, where that wouldn't be for their peers without autism. Under-responsive children are often under-responsive to pain, and this can put them at greater risk for things like self-injury. And then I do want to note that autism spectrum disorder appears in the full spectrum of intellectual ability. So children with autism spectrum disorder are not necessarily intellectually inferior to their peers or anything like that at all. And many children with autism spectrum disorder struggle with executive functioning, and then they can also have behavioral issues such as aggression and self-injury. Now, looking specifically at girls, research and studies have focused on what they refer to as the female autism phenotype, which is the idea that autism spectrum disorder presents differently in females and that sex and gender play a role in how it presents. The main 4 features of this female autism phenotype are social motivation, camouflage, co-occurring difficulties, and special interests. For social motivation, research shows that girls with autism spectrum disorder tend to show much higher interest in friendships and other relationships than their male peers. They are also much more driven and much more adept at camouflaging or masking characteristics and traits that are considered autistic. They have co-occurring difficulties. They are much more likely to have things like anxiety disorders, eating disorders, and mood disorders than their male counterparts with autism spectrum disorder. And then their special interests. Across all of autism spectrum disorder, it is very common for intense and repetitive interests to be present. While boys tend to show interest in mechanics and mathematics, girls are more likely to have interests that are considered normal by educators and instructors, such as pop stars, animals, and books. It's also worth noting that a lot of these interests come from social influence and their peers. Now, Autism spectrum disorder does not have any given one cause, and it's noted that about 85% of cases have no known cause. However, there are certain factors that play into it. Genetics, if a child has autism, then their siblings are much more likely to have autism, which is the grounds for the belief in a genetic factor. Neuropathology, current research shows that abnormal prenatal and postnatal brain development and structure can be an origin. However, there is no one abnormality that is the sole cause of autism. And then environmental factors. Expectant mothers who are exposed to higher levels of air pollution, are more likely to give birth to a child with autism spectrum disorder than mothers who are in cleaner settings. And children who grow up spend their developmental years in these toxic environments and around toxic chemicals are also more likely to show characteristics of autism spectrum disorder than peers who do not. Now, we want to look at diagnosis. Diagnosis is especially important with girls. As researchers show, girls and women with autism are often undiagnosed, misdiagnosed, or receive a diagnosis of autism at a later age. This can result in adverse outcomes in their well being, mental health, education, employment, and independence. So, this is why diagnosing girls with autism is so important and looking at how their diagnosis process differs. So, we want to look at the standard process for identifying and diagnosing autism. The first year, children often with autism do not show any signs. It's not until that 12 to 15-month point where parents with children with autism start reporting a difference in behavior, start reporting oversensitivity, increased unresponsiveness, and a withdrawn attitude from their children. Now, whether or not these characteristics are shown, the American Academy of Pediatrics recommends that all children be screened both at 18 months and 24 months. The reason for both screenings is that the 24-month screening lets professionals identify any regression from the 18-month. Now, it's worth noting that these screening tests are not diagnoses, but are used to identify traits and characteristics and identify individuals who might need evaluation and diagnosis. So the evaluation process for diagnosis should always be undergone with a professional with expertise in autism spectrum disorder and will usually consist of multiple aspects, namely observations, interviews, and ratings of the child's behavior. Girls are often diagnosed less for a variety of reasons. As we already mentioned, they are better at camouflaging and they are more intentional about hiding autistic traits and characteristics. They also suffer from comorbidity more often. It is more likely for girls and women with autism spectrum disorder to have ADHD, bipolar disorders, anxiety disorders, and eating disorders. These disorders all share common symptoms, and thus it is more likely for doctors to be diagnosing these disorders, as they are somewhat more common, than autism in females. It's also worth noting that all of the research that makes up the sort of foundation for scholastic literature on autism was male focused. Because of this, also, and because girls are already underrepresented, there is less research on women and less women on whom to base research. So, knowing that this diagnosis discrepancy is here, the best way for educators, instructors, and other professionals to be able to identify girls and women with autism, despite having this discrepancy in diagnosis, is experience with other children with autism spectrum disorder. Research has shown that specifically in the education setting, instructors who have at least 4 years of experience working with children with autism are much more likely to identify autism in girls and women than instructors who do not have that experience. Moving on to psychosocial impact. Girls with autism spectrum disorder often put a higher priority on social relationships and are often better at masking, as we discussed in characteristics. This often does mean that girls are more prone to hiding social confusion and they are less likely to seek support. However, it does mean that their relationships do appear on the surface more typical. Now, sexuality is a big thing that is affected particularly in women. It is shown in research that women with autism report being homosexual at higher rates. It is also shown that women with autism have higher rates of bisexuality and asexuality than their peers without autism. Women can also be prone to more sensory difficulties when they have autism, and this can affect their sexuality and their sexual expression, which in turn affects their relationships. Unfortunately, research also suggests that women with autism spectrum disorder are more vulnerable due to many factors, including social naivete, to sexual harassment and sexual assault. So it's very important that these women receive not only more support, but more intensive support. Comorbidity, I've talked about this a little bit already, but it is much more likely for women with autism to also be diagnosed with anorexia or with ADHD, tic disorder, bipolar disorder, or mood and anxiety disorders. Um, the main thing among all of these is just that these are disorders that also have drastic effects on how a life is lived and can affect relationships. And so it is worth noting that they are more likely to occur when autism spectrum disorder is diagnosed. For employment, unfortunately, research shows now that it is very difficult for women with autism spectrum disorder to maintain long-term employment. However, receiving supports makes it much more likely for them to continue their employment. And another factor that increases the likelihood of continued employment is special interests. As I've already mentioned, the special interests for women and girls with autism tends to vary from the special interests that we think of and that the special interests that boys and men often have. And special interests for women, it can include dance, literature, um, social behavior in animals and in humans is a big one. Pursuing a field based on their special interest does increase the likelihood that a woman with autism spectrum disorder will stay employed and will have that long-term employment. Lastly, we want to look at the educational impact. This is a big one. How do we adapt our classrooms to better suit and support these students? So, in the classroom, we want to focus on three things. The main one for girls specifically is identification. We've talked a lot about how this phenotype differs from the male phenotype and differs from what research we have that is so male dominated. Therefore, we need our educators to be familiar with the nuances of the female autism phenotype and be able to identify when that phenotype might be present. I've also already mentioned that girls are much less likely than their male peers to seek support for their autism. Thus, instructors must be able to identify that phenotype and also be um, forward and proactive about providing that support and take initiative in getting support for students that they think might be exhibiting that phenotype or might need that support. Intervention is a big one for all students. Early identification is super important, and early intensive behavioral intervention is shown to be one of the most effective educational approaches for children with autism. Even if we can't catch it early, as we often cannot with female students, a combination of visual supports like visual activity schedules and applied behavioral analysis, which we'll talk about on the next slide, is one of the most effective ways of socializing children and supporting them in your classroom. Now, to briefly talk about placement. Placement in standard classrooms will be much more common for students with autism, specifically girls with autism, than their male peers. It's already more common for students with autism to be in normal classrooms, but girls especially, because they show that higher social motivation, they are much more intentional about making friends and much more focused on maintaining like best friend relationships. And because of this reason, it is more likely that they will be in the standard classroom where they are able to socialize and have those relationships. For any student, but especially girls who are not put in the standard classroom and are instead in a resource room, the main emphasis there is that every second counts. Because these emphasis rooms and these interventions can have such drastic positive effects, we want to be wasting no time in going through the processes in these rooms that can have improvement, because there's such a good window for improvement there. We want to be taking advantage of it as much as possible. Now, for our last slide, I want to talk about applied behavior analysis techniques and how this applies to children with autism and girls with autism in schools. Girls with autism still show that sort of repetitive behavior and reliance on routines. So we want to be positively reinforcing any behaviors that show adaptation and changes in behavior and give them a bit more flexibility. We also want to focus on shifting control over a student's responses to naturally occurring stimuli. So what this is talking about is we want them to have control with naturally occurring stimuli rather than having control only through stimuli that we are manipulating so that they are more self-sufficient. Behavioral skills, like we already talked about in terms of careers, without supports, girls and women struggle to maintain employment. So, by giving them behavioral and educational and employment skills, we are able to sort of increase their chances and give them some of the support they need when finding employment later in life. Alternate instruction methods are also a big one. Instruction methods for language should always be based on an analysis of how your child with autism is already speaking, their verbal behavior, and then other methods of instruction like equivalence based instruction can make things more easy for these children to understand. Lastly, we want to focus on self management, especially for girls. Girls, like I've mentioned, are less likely to seek support, and thus their ability to manage themselves is more important than their male peers at times. So we want to be able to teach these girls to manage their emotions and behaviors and relationships in healthy ways. And when I say non harmful ways, I specifically mean avoiding self injury, as again, children with autism spectrum disorder can sometimes be prone to self injury in the way that their peers without autism are not. Thank you. This is my works cited.